Hello, this is Dr. Philip Mease, Director of Rheumatology Research at Swedish Medical Center and Clinical Professor at the University of Washington School of Medicine in Seattle, Washington. I will be discussing the abstract Ixekizumab exhibits a favorable safety profile during 24 weeks of treatment in subjects with active psoriatic arthritis. Integrated safety analysis of two randomized placebo-controlled phase 3 clinical trials by myself, along with Drs. Burmester and Moriarty and colleagues. This abstract was presented at the American College of Rheumatology meeting in November 2017. I selected this abstract because it highlights the most recently FDA-approved, December of 2017, IL-17A antagonist, Ixekizumab for PSA. This study shows the safety profile of Ixekizumab during the placebo-controlled treatment period was consistent with published findings in patients who received Ixekizumab for moderate to severe plaque psoriasis. A total of 678 adults with active PSA were randomized to 80 milligrams of Ixekizumab every 4 weeks or 2 weeks after a 160 milligram starting dose or placebo. Safety data are presented from the placebo-controlled treatment periods, weeks 0 to 24, for patients who received at least one dose of the study drug. At week 16, patients deemed inadequate responders received rescue therapy and were included in this data set only up to week 16. Primary outcome was the integrated safety of two pivotal trials in patients with active PSA. SPIRIT phase 3 trials consisted of patients with active PSA who were biologic DMARD naive or inadequate responders to TNF inhibitors. Data was analyzed using a Cochrane-Mantle-Hansel test stratified by trial. What were the key findings? There was no clear difference between groups for the percentage of patients with greater than or equal to one serious adverse event or discontinued early from study drug. Adverse events of special interest from 0 to 24 weeks included infection-related serious adverse events, with the overall frequency being quite low, 1% in the total Ixekizumab group versus 0 in the placebo group. The rate of candida infection was slightly higher in the Ixekizumab group than placebo, 3% compared to less than 1%. There was no case of Crohn's disease or ulcerative colitis. Two cases of malignancy, prostate cancer and basal cell carcinoma, were reported in the Ixekizumab Q4 week arm. However, there was overall no specific malignancy signal, and the rate of malignancy was quite low, less than 1%. There were no major adverse cardiac events, and there were no deaths or reports of suicide or suicidal ideation. The safety profile of Ixekizumab was consistent with published findings in patients receiving Ixekizumab for moderate to severe plaque psoriasis. As lead author, here are my thoughts and analysis of this study. This study showed a range of serious adverse events of 1.5 to 2.5%, which is relatively low compared to many other trials of biologic agents. None of the studies are head-to-head trials. That said, the overall rate of serious infection is less than that observed in trials of TNF inhibitors. The serious infection rate was higher than placebo. Therefore, clinicians should speak to their patients about the risk, even while understanding that the potential for serious infection is low. There was no specific malignancy signal, and the rate of malignancy was low. There was no adverse cardiovascular signal. Although there were no cases of Crohn's or ulcerative colitis flares in these studies, IL-17 inhibitors in general do not seem to protect against flares of IBD. This is important because we know that there is a genetic greater risk for IBD in patients with psoriasis and psoriatic arthritis. In the psoriasis studies with this agent, a few cases of IBD flares occurred, both in patients with known IBD as well as new onset, more in the treatment group than placebo. So we know that this can occur, but it just wasn't seen in these psoriatic arthritis trials. These results underline the point that IL-17 inhibitors seem to be overall quite safe and can be used with confidence from this perspective. We see slightly higher rate of serious infections in placebo. There is a slight increase of Candida infection, which is expected because IL-17 is a known protector against Candida. However, this adverse event was typically mild to moderate and easily managed.